to you today. My name is Tera McIntosh, and I'm on faculty at the College of Pharmacy, and I'm also the college advisor for our Student Operation Immunization Committee. I'm out of the country right now, and so I appreciate the opportunity to record this presentation to present to you this morning. The project that I'm proposing, student-driven campus outreach activities to prevent cervical cancer through HPV vaccination, will be a student-led project. Our students in the past have provided educational outreach to students at UK, and this project will allow us to combine vaccine efforts to improve access and reduce the burden of cost for UK students. This will allow us to immediately improve preventative health care outcomes and long-term reduction of cervical cancer rates. A more complete description of the project being proposed is that our College of Pharmacy students are trained as a part of their curriculum to assess and administer adult vaccines. Our college also has an American Pharmacist Association Academy of Student Pharmacists Operation Immunization Committee. This is a service-oriented committee with goals to increase public knowledge of immunizations and raise the number of adults receiving immunizations. The College of Pharmacy Committee has a long-standing record of service that includes assisting University Health Service and UK Healthcare with annual vaccine campaigns. Our College of Pharmacy students specifically provide an estimated 3,000 plus student and employee vaccines each year in their participation in these efforts. Our committee also participates in many educational outreach events annually, including a human papillomavirus awareness and vaccine advocacy outreach. We developed and implement this outreach in campus housing locations in each spring semester. Post-activity feedback tells us UK students need and are interested in HPV vaccine at these events. However, we have never had the opportunity to obtain and administer vaccine due to cost to make it available while student interest is piqued and access would be convenient. Funding of this proposal would provide the Operation Immunization Committee opportunity to meet both tenets of our committee service goals, but more importantly, it would make a long-standing impact on student health by increasing HPV vaccination on campus, and HPV vaccine protects against infection from 9 types of HPV-associated cervical cancers, thereby reducing long-term risk of cervical cancer. Rationale from this project comes from the unfortunate circumstance that Kentucky is a state that experiences high cervical cancer rates and deaths compared to the rest of the country. We rank in the top 10 in both, so there is much room for improvement. The HPV vaccine has been available for over 10 years now. In that time, positive health outcomes observed have included significant decreases in the rates of HPV infections and cervical precancers, which are abnormal cells on the cervix that can lead to cancer. Specifically, even with less than ideal vaccine rates in these past 10 years, it is estimated to have decreased infections with HPV that can cause cancers and sexually transmitted genital warts by 86% in teen girls, 71% in young adults, and it has observed a 40% decrease in cervical precancers caused by human papillomavirus. Recall that Kentucky has one of the highest incidences of cervical cancer rates. We also rank in the bottom 10 of percent of adolescents who received the HPV vaccine. In 2017, Kentucky had less than a 20% full completion rate for the vaccine series. So our high incident rates are not all that surprising considering the lack of uptake of vaccine in the state. Again, there's much room for improvement, and these statistics tell us the majority of our students on our campus are also likely unvaccinated. HPV vaccine is recommended to be given starting at age 9, and the target age for the vaccine is at the 11 to 12-year-old well visit check. However, vaccine is recommended up to 26 years of age if it did not occur at target times, making college students another important target. Fortunately, a study conducted last year in Kentucky in nearly 600 college students, 74% of whom were in-state residents, reported that college students are interested in HPV vaccine. The study showed that one of the biggest factors that would influence a college student's decision to get HPV vaccine was access to a free vaccine. Funding of this project can make that a reality for students on our campus. As far as benefits to our students, there are at least 4 that are easily identifiable. The most important and impactful benefit will be preventative health benefits to students who receive HPV vaccine. These students will also realize a long-term health benefit of greatly reduced risk of HPV-associated cancers. Secondary benefits for College of Pharmacy students include ability to implement classroom-learned skills while impacting public health of UK students. Our student pharmacists are eager to put their professional skills to work and make a public health impact once they learn to immunize. In addition, the co-chairs of the Operation Immunization Committee, who will work with me to plan, organize, and carry out this project, will benefit from a scholarship toward their tuition for their efforts. Select few committee members will also recognize this benefit to help the co-chairs at the actual outreach activities to administer vaccines. Last, as part of this effort, our immunization co-chairs will learn to prepare a presentation and disseminate project efforts and outcomes with other student pharmacists and pharmacists in both a national and state pharmacy convention. This will be a valuable career development activity for those students. Finally, as you can see, the majority of the requested funding will go to purchase of vaccine and vaccine-related necessities. I've conservatively estimated that we will be able to purchase at least 200 doses of vaccine. I also have received confirmation from UK Healthcare that there is possibility for billing of student insurance. If that possibility is realized, that number will largely increase. The remaining funding will be awarded to the student co-chairs and members who will work with me to plan, organize, and implement this project in the student housing complexes. That core group of students will need to visit those complexes multiple times to provide the vaccine series recommended. Now I want to take the opportunity to answer some common questions that arose during the last proposal of this project. First, the question was asked why we weren't targeting students off campus in more rural areas, in high schools or other areas. Logistically, that is a challenge because pharmacists in the state of Kentucky need a prescriber-approved protocol to administer vaccines. Access to that protocol off campus is difficult to find. In addition, parental consent would be required in those students, making that a more difficult target age range. Again, thank you for this opportunity, and I look forward to hearing back with you on your decision.
Hi, I just have a quick question. Can we cover the $35,000 for vaccines? Is that what Women in Philanthropy would be able to cover? Past or future leaders?
It's on. Okay, so to recap on our established funding criteria, okay? So scholarships can cover tuition, mandatory fees, room and board, books. It may also cover other experiences such as cultural, health insurance, childcare, and etc. So a health-related serum would be etc. Okay. Students. Right, when we ask them for more clarification on their proposal, the serum could be covered as et cetera, and it's being administered to students. By students, to students, by students, okay? One other one, just so, I'll just keep reading because this will address the other one. So the other point, I think, is the faculty piece, right? So the proposals should not include support for faculty salaries. That's it, faculty salaries. Furniture or equipment, okay? So, and equipment is sort of a loose interpretation, obviously. What's equipment? What's a product to be used? And then, does that help? So we're ready for our next one. So we'll talk some more at lunch, but does that help?